It is often jokingly said that no man's life, liberty, or property is safe when the legislature is in session. But the violation of our rights is not a joking matter. Legislators are intent on controlling more and more of our lives, and it is time that citizens took that matter very seriously. Guard with jealous attention the public liberty. Suspect everyone who approaches that jewel. Georgia, your privacy rights are at stake. For several years now, the Georgia Drugs and Narcotics Agency has been pushing state lawmakers to create a centralized state surveillance system to monitor the private medical records of Georgia citizens. This year, it may actually happen, because the sponsor of the bill has repeatedly misrepresented the bill's intent in front of committee hearings and in front of the entire Georgia House of Representatives.
Mr. Speaker, members of the committee, I bring you the following substitute to House Bill 614. It establishes the Georgia Prescription Monitoring Program Act. This would be under the Georgia Drugs and Narcotic Agency. What it would mean, we're having a great problem in our state with the diversion of prescription narcotics. In fact, it is a growing problem with our young generation. They're not out buying drugs on the street. They're just going through everybody's medicine, their parents' medicine cabinets, and taking the prescription narcotics.
So I guess we're worried about the threat of a wild and crazy teenager taking her mother's Ambien and passing out instead of cleaning her room. These politicians that are supposed to be fiscally conservative think this is a great idea because it allows them to spend even more of our money. But this time it doesn't come out of the state budget, at least not for a couple of years until the federal grant money they are seeking with this legislation has run out. That's right, our federal government, in its infinite wisdom, has allocated thousands of our taxpayer dollars to the United States Department of Justice to entice states to crack down on doctor shoppers. Notice this grant comes from the Department of Justice, a federal agency charged with arresting citizens, as opposed to Health and Human Services, an agency responsible for protecting the health of citizens. Actually, a similar grant program was created under HHS, but it was never allocated any money in the federal budget. I guess they would rather have our tax money go to spending more money on the failed war on drugs than on legitimately trying to help drug abusers get better and become more productive members of society. Or, God forbid, just give us our money back. What's next? Privacy and due process violations? 1984, Big Brother is watching. Is there going to be a database for alcohol? Wait, don't give them any ideas. Here's a scene from the future. You're at a liquor store. You try to buy alcoholic beverages, but you're denied access to alcoholic beverages, not because it is Sunday, another stupid Georgia law, but because you purchased alcohol the previous day. You're obviously incensed because the alcohol being purchased that day is not even the same alcohol purchased the previous day. Liquor store owner denies access to alcohol because all alcohol has the same ultimate effect, drunkenness, and the state has the important governmental interest in regulating consumption of alcohol for the safety of others. The state assumes that all people will abuse alcohol and must therefore be regulated. There are also severe unintended consequences of this legislation. The American Cancer Society, as well as other patient advocates of the healthcare community, have raised legitimate concerns that increased regulatory scrutiny could lead to a reduction in certain medications prescribed for fear of being investigated by law enforcement officials, which could lead to increased prescriptions for weaker, less effective pain medications and decreased access to appropriate medication for legitimate pain patients. There are no studies which conclusively disprove this fear. However, there are less intrusive, much more reasonable and balanced alternatives that actually do improve healthcare quality and effectiveness without invading the rights of citizens and which avoid the potential unintended consequence of a reduction in the prescribing of needed medications. For instance, Maine's prescription monitoring program was actually developed to improve the quality of the prescriber-patient relationship rather than as a law enforcement tool. In Maine, pharmacists and prescribers can access the system for information regarding their patients only. Licensing boards may use the information for investigations they are conducting. Law enforcement officials can access the data only through the Attorney General's office by grand jury subpoena for a case they are currently investigating. Also, there is no recourse for privacy violations. Anyone who disseminates a patient's private medical records is punishable only if they did it willfully or intentionally, but cannot be punished if they did it in good faith, aka negligently or on accident.